Losartan is one of the most commonly prescribed blood pressure medications in the world. Doctors trust it, patients take it daily, and for most people, it works quietly in the background, lowering blood pressure and protecting the heart and kidneys. But here's what almost no one tells you. Some of Losartan's side effects don't show up where you expect them. They don't always feel like blood pressure problems. Instead, they can affect your nose, your muscles, your sleep, your digestion, and even the way your body senses taste and smell. Because these effects seem unrelated, many people never connect them to their medication. In this video, we're going to talk about the weird and unexpected side effects of Losartan, the ones patients often mention casually, the ones doctors hear but don't always emphasize, and the ones you should recognize early. This isn't about fear. It's about understanding what your body might be trying to tell you. Let's start with persistent nasal congestion or runny nose. One of the strangest side effects people report on Losartan is chronic nasal congestion or a constantly runny nose, even without a cold or allergies. This can feel like mild sinus pressure, postnasal drip, or a nose that just never feels clear. This happens because Losartan blocks angiotensin II, a hormone that normally causes blood vessels to tighten. When those blood vessels relax, including the tiny ones in the nasal passages, they can swell slightly and produce more mucus. The result is congestion that doesn't respond well to allergy medications. Many patients assume they've developed new allergies, when in reality, it's a medication-related vascular effect. Also, dizziness that comes and goes randomly. Dizziness is listed as a common side effect, but what surprises people is how unpredictable it can feel. Some patients feel fine for weeks, then suddenly experience lightheadedness when standing up, bending over, or even turning their head quickly. Losartan lowers blood pressure not just in the arms, but throughout the body, including the brain. If your pressure drops slightly faster than your body can adjust, less blood reaches the brain momentarily, causing that brief dizzy or floaty sensation. This effect is more noticeable when starting the medication, increasing the dose, becoming dehydrated, or combining Losartan with diuretics. The third is muscle cramps or unusual muscle weakness. Another unexpected side effect involves the muscles. Some people on Losartan report leg cramps, muscle aches, or a feeling of weakness that doesn't clearly match exercise or activity levels. Losartan can affect potassium balance in the body. In some people, potassium levels rise slightly, which can interfere with how muscles contract and relax. Even mild electrolyte shifts can cause cramping, twitching, or heaviness in the limbs. This is why routine blood tests are important while on Losartan, not because problems are common, but because they're often subtle before becoming noticeable. Next is changes in taste or metallic mouth sensation. This one surprises many patients. Some people report a strange metallic taste in the mouth, reduced taste sensitivity, or food simply not tasting right anymore. While uncommon, this can happen because angiotensin receptors are present in the nervous system and salivary glands. When these pathways are altered, taste perception can change slightly. The effect is usually mild but can be frustrating, especially when it affects appetite. The good news is that this side effect often improves over time or resolves after dose adjustment. Number 5. Digestive discomfort that feels unrelated. Losartan can occasionally cause vague digestive symptoms like mild nausea, loose stools, abdominal discomfort, or bloating. These symptoms don't always start immediately and may come and go. The gut has its own local blood flow regulation and nerve signaling. When vascular tone changes due to Losartan, digestion can feel temporarily off balance. Because these symptoms aren't dramatic, many people never mention them, yet they improve when the medication is adjusted or taken with food. The next is sleep changes or vivid dreams. Some patients notice changes in sleep after starting Losartan. This can include difficulty falling asleep, more frequent awakenings, or unusually vivid dreams. Angiotensin receptors are involved in regulating the stress response and sleep-wake cycles. Altering this system can subtly affect how deeply or consistently someone sleeps. While not dangerous, it can affect quality of life, especially if the connection isn't recognized. Lastly, increased sensitivity to dehydration. Losartan can make some people more sensitive to dehydration, especially during hot weather, illness, or exercise. Because it relaxes blood vessels and affects kidney blood flow, even mild dehydration can cause fatigue, dizziness, or weakness. This doesn't mean you need excessive fluids. It means you need consistent hydration and awareness of how your body responds under stress. What you should do if you notice these symptoms: never stop Losartan abruptly without medical advice. But if you notice new or persistent symptoms after starting or adjusting your dose, talk to your doctor or pharmacist. Often, small changes, Timing, dose, hydration, or combination therapy make a big difference. Losartan is an excellent medication for many people. Understanding its full range of effects helps you use it safely, comfortably, and effectively. In conclusion, blood pressure medications don't just affect numbers on the monitor, they affect real systems in your body. When you recognize unusual symptoms early, you move from guessing to understanding. If this video helped you recognize something you've been experiencing, please like, share, and subscribe for more clear, honest explanations of medications and health topics. The more you understand your treatment, the better it can work for you. Your body always gives feedback. The key is knowing how to listen.